Dear colleagues, let me present my 12-month progress report on my PhD topic, which is cervical disease and their connection with health and clinical factors. I am a resident doctor at the Department of Obstetrics and Gynecology. My vision is that primary HPV detection-based cervical cancer screening will be implemented in Hungary in the next 5 years in the above 30 years age group. My mission is to change the Hungarian guidelines on cervical cancer screening and treatment. I have two specific goals to achieve this vision and mission. The first is trichomonas vaginalis infection is associated with increased risk for cervical carcinogenesis, and the second project is the effect of topical imiquimod therapy on reducing cervical intraepithelial neoplasia. So, jumping to the first project. So currently the status of the manuscript is, this is now in internal review, and we hope to submit in the American Journal of Obstetrics and Gynecology. So to give you some background on topic, lifetime prevalence of HPV is around 80%. So this is necessary but not sufficient for causing cervical cancer. Trichomonas vaginalis infection causes inflammation and decreases protective barriers of the cervix and vagina. So inflammation of the cervix causes persistent HPV infection and progress in cervical carcinogenesis. Other estimation is that TV can carry HPV as a Trojan horse. Our aim is to assess the effect of Trichomonas infection on increased risk of cervical carcinogenesis. Our clinical question is that does Trichomonas vaginalis infection increases the risk of cervical carcinogenesis? We have two PO. The first are the sexual active women. We would like to see the TB infection, and for outcomes we would assess the HPV infection and cervical cytology and histology statuses. The other populations are HPV positive women, and we would assess cytology and histology. And our hypothesis is that Trichomonas vaginalis infection increases the risk for cervical carcinogenesis. So we did our systematic search. This is the flow chart of the selection. We found 29 eligible texts, and here you can see the results. This is a subgroup analysis based on the detection method of Trichomonas vaginalis. So there is PCR, stain or wet mount, and cytology. And we can see that women who were TB infected had an increased odds for the detection of HPV co-infection. So there is an association between the two infections. The second result is, this is again a subgroup analysis based on the detection method of Trichomonas vaginalis. And this outcome assesses the Trichomonas vaginalis and high-grade squamous intraepithelial lesion. And once again, there was a connection and an increased odds for detecting for high seal in case of a present Trichomonas infection. And this figure shows the cervical cancer status. So in case of Trichomonas detection, there was an increased odds for detecting cervical cancer. This is the second population I've already mentioned. So these women were all HPV positive, and here we assessed cervical outcomes, low-grade squamous intraepithelial lesion, high-grade squamous intraepithelial lesion, and cervical cancer. And in all the three cases, we could found an association between Trichomonas vaginalis and these cervical aberrations and cervical cancer. So to summarize our meta-analysis, there is some strengths. So this was the first meta-analysis which investigated TB infection and HPV infection and different cervical lesions. It has a huge sample size. Nearly 500,000 women were in the study. And it's globally quite representative studies from all around the world. So about the limitations, these are mostly cross-sectional studies, and cervical cancer is caused by many agents, so not only HPV, and unfortunately in the articles we didn't have enough controls of these other causes, so the confounders were not assessed enough or within good reach. And some cases we experienced high heterogeneity. So the conclusion is the detection of HPV infection and cervical intraepithelial neoplasia is increased in the trichomonas vaginalis infected population. In the subgroup analysis, there were significant differences between the odds ratios, and the highest odds ratio was with the detection of PCR and wet mount. So to summarize, the implication for practice that there is a strong suggestion to also screen and treat trichomonas vaginalis in case of diagnosis of HPV infection. And the implication for research is that, of course, there are not enough longitudinal studies, so they are needed in this topic. So to jump to the next project, this is the effect of topical imiquimod treatment on reducing cervical neoplasia. So also to give you some background, usually guidelines recommend surgical therapy for cervical HCIL, and around 90% of cases HPV is responsible for these lesions, but surgery doesn't necessarily treat the infection, and topical imiquimod is an immune response modifier and approved for genital warts, basal cell cancer, and actinic keratosis in other fields of medicine. Imiquimod fastens HPV clearance by 60% in one study, and our aim is to assess the safety and efficacy of topical imiquimod therapy on reducing cervical intraepithelial neoplasia. Clinical question is that what is the response rate to topical imiquimod therapy in cervical intraepithelial neoplasia? We will use the COCOPOP framework because in the studies sometimes there are not much of a control group, but we would see the response rate to topical imiquimod women who have cervical intraepithelial neoplasia. And in the second clinical question, we would assess, we would have the control group and have a standard care, and we would see the response rate as well. And our hypothesis is that topical imiquimod therapy is effective in reducing cervical intraepithelial neoplasia. So we did the preliminary search, but because we are mainly focused on the first project, after we submitted the first project, we will focus more on this second one. And yeah. So thank you very much for your kind attention. And I would like to close my. So if you think you are too small to make a difference, try sleeping with a mosquito. Thank you very much.
Thank you for your presentation. My question is about your first project. So you mentioned that you suspect that there is a connection with the trichomonas vaginalis infection and the HPV infection, and I just wanted to ask about the timeline. So in these articles, is it proven that the trichomonas vaginalis infection was before detection of HPV, or is it coexistent, or is it possible that because of the HPV infection the barrier is already a bit damaged, so they are more susceptible for trichomonas infection?
Yes, actually, these are mostly, if not all, are cross-sectional studies. So they are the trichomonas and HPV were screened concomitantly, and there's no timeline basically, and of course this is a limitation of the study because we cannot answer to your question based on our study. Yes.
If I can ask a question too, actually, I'm very boring because I asked the same kind of question as with the previous one. Although, I mean, before that, just a comment that I think your study really highlights the importance of meta-analysis, because there is a number of different studies and actually quite wide range, but when you add all these data together, I mean, just a clear view is coming, which is not coming out from the individual studies. Still, I mean, in some studies actually there were no difference, and in some other studies actually there was a quite striking difference. So did you see, as you look at the individual papers, that what is the reason for these different areas of the world, different whatever? Do
you mean there is a difference incidence rate of trichomonas in the individual studies? Yeah, because generally the incidence of trichomonas really varies around the globe. So, for example, the incidence will be really different in South America and in Europe, for example, and actually quite experienced that. And the other thing is sample size. So some studies dealt with just a couple of hundreds of patients, and somewhat they detected relatively high number of patients with trichomonas, which is not necessarily representative when we look at different studies which have a bigger amount of sample size, which can be more closer to the actual presence of the trichomonas vaginalis in the population.
So Balázs, why do you think that you can investigate the effect of trichomonas infection on the HPV infection? Because in the beginning of your speech, you said that you wanted to investigate the effect of etc. Is it the right wording? What do you think?
Well, currently, your question is a little bit related to the first question, that the true effect cannot be measured with our data. We can only say that there is an association between the two infectious agents. So we cannot say that this is a causative relationship. We can only see that there is, when we do a cross-sectional analysis, that the two infectious STIs are together quite commonly. But of course, that we cannot say that. So this is evidence for that TV can cause or can decrease the protective barriers and cause HPV infections more easily.
Yes, so in that case, we cannot talk about causality. So pay attention to this kind of wording, because if you use this way, the reviewer will correct this wording, so there is no effect. Yeah, okay. After I know you used only association or relationship or something like that, but there is no effect,
Yes, you're absolutely right, and fortunately in the manuscript we always used association and actually highlighted that there is no effect. Yeah, sure. It's,